Could high blood pressure be silently affecting your health? When was the last time you checked your blood pressure? Often called the silent killer, hypertension can cause serious damage without noticeable symptoms. Hypertension, also known as high blood pressure, occurs when the force of blood against your blood vessel walls is consistently too high, typically measured at 140/90 mm of mercury or higher. While it's a common condition, untreated hypertension can lead to serious health complications, such as heart disease, stroke, or kidney damage. That's why early detection and proper management are so important. Have you ever experienced severe headaches, chest pain, dizziness, anxiety, or nausea and vomiting? Watch out, these could be warning signs of hypertension. To address the personalized needs of hypertension patients, we conducted a study involving 45 individuals with varying characteristics that aim to identify the most effective of different hypertension treatments. Hypertension is influenced by a variety of factors. The first group of factors that we study is by gender and age group. Based on the study, blood pressure rises with age for both males and females, peaking in the 70 to 79 group. Males generally have higher readings than females, especially in the 60 to 69 age range. Based on the study done by Cheng et al. In 2022, there is a rapid increase in the risk of developing hypertension in women aged 35 to 55 years old, which is linked to hormonal changes, particularly the transition to menopause. However, the risk becomes lower during the 55 to 80 age group. During this period, the risk continues to rise, but at gradual pace which is likely influenced by age-related factors. Next is gender and BMI, which is body mass index. The study shows severe obesity leads to the highest blood pressure in both males and females, followed by obesity. It shows that higher BMI is strongly linked with increased blood pressure for both genders. The excess fat increases blood volume resistance within the arteries. According to Landy, they found out that both systolic and diastolic blood pressure increase significantly and linearly with higher BMI levels, even after adjusting for age and other risk factors. The third group is the total cholesterol trends by LDL and HDL levels across age groups. Total cholesterol rises with increasing LDL, especially in the 70 to 79 age group. Higher HDL levels are linked to lower total cholesterol, notably in younger adults. This highlights the importance of controlling LDL and boosting HDL for better cholesterol management, particularly as age increases. When cholesterol levels are high, it may block the bloodstream, causing excess cholesterol to deposit along the artery wall and making it stiff and narrow. The heart must work extra hard to pump blood to the whole body. This causes the blood pressure to increase and leads to hypertension. For alcohol consumption, people who drink alcohol and don't take their medication as prescribed have higher blood pressure. Similarly, non-drinkers who aren't adherent also show higher blood pressure. This highlights the importance of both avoiding alcohol and sticking to the medication to manage blood pressure. Those with a family history of hypertension tend to have higher readings, especially among African Americans. Even without a family history, African Americans and Hispanics still exhibit higher blood pressure, which can be from the influence of both genetics and racial factors. The last factor shows blood pressure by comorbidity status across racial groups. Individuals with comorbidities have higher blood pressure, especially among African Americans and Hispanics. Without comorbidities, blood pressure is lower for all, but Caucasians still show relatively high readings, which can be caused by diet and lifestyle. Let's go over the main types of hypertension treatments, which are ACE inhibitors, beta blockers, and calcium channel blockers. ACE inhibitors help lower blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2, which is a compound that tightens blood vessels. This action relaxes the blood vessels and reduces fluid retention. According to Maselli, ACE inhibitors offer heart and kidney protection, making them ideal for long-term hypertension control. Beta blockers work differently by lowering heart rate and reducing the heart's pumping force. They are effective in treating portal hypertension, often linked to liver disease, by decreasing blood flow and pressure in the abdominal veins. Berry and Garcia noted the effectiveness in reducing the blood return to the heart and lowering cardiac output. Calcium channel blockers, or CCBs, reduce blood pressure by blocking calcium entry into muscle cells and blood vessels, causing them to relax and widen. Tochi et al. Found that CCBs effectively lower systolic and diastolic pressure and help prevent major cardiovascular events like strokes. Factors like age, gender, Race and other health conditions affect the choice of treatment. Age influences the progression and severity of hypertension. Based on the result, older adults are frequently prescribed diuretics and SE inhibitors like hydrochlorothiazide and lisinopril due to the proven efficacy in reducing blood pressure and improving cardiovascular protection. These medications are often preferred for managing age-related changes such as decreased arterial elasticity and increased vascular resistance. Gender also significantly impacts treatment strategies due to the physiological and hormonal differences. Women, especially postmenopausal women, are often prescribed diuretics or calcium channel blockers, which have been shown to be effective in addressing fluid retention and reducing cardiovascular risk in women. On the other hand, men are more likely to be prescribed beta blockers and higher dosages of SE inhibitors, potentially due to the generally high cardiovascular risk profile and greater likelihood of conditions like left ventricular hypertrophy. For instance, older women may benefit from lower dosages of diuretics to minimize the risk of electrolyte imbalances, while older men might receive more aggressive treatment with beta blockers or SE inhibitors due to their higher risk of heart attack or stroke. The treatment for hypertension also differs based on race. The study reveals some distinct trends in medication used across different racial groups. For instance, African American patients show high counts for medications like amlodipine and hydrochlorothiazide. This aligns with clinical guidelines that suggest calcium channel blockers and diuretics are often more effective in African Americans due to difference in salt sensitivity and lower renin activity. Caucasians appear more frequently prescribed with SE inhibitors like lisinopril and beta blockers such as metoprolol, which are generally recommended for patients with a high prevalence of cardiovascular disease. Asian and Hispanic groups showed varied usage patterns, with Asian patients more commonly prescribed with medications like diltiazem, which may be influenced by the lower risk of adverse metabolic effects compared to other drugs. Hispanic patients have a slightly higher count for drugs like enalapril, reflecting treatment preferences that consider the prevalence of diabetes and heart disease within this group. These variations suggest that racial differences, including genetic factors, lifestyle, and specific health risks, significantly influence the choice of hypertension medication. Hypertension is a serious medical condition that affects not just the heart, but can also pose significant risk to the brain, kidneys, and other vital organs. It is a leading cause of premature death globally, affecting about 1 in 4 men and 1 in 5 women, totaling over 1.28 billion people worldwide, a figure that has doubled since 1990. According to the World Health Organization, over 700 million people still have untreated hypertension, making them vulnerable to severe complications. One such complication is hypertensive retinopathy, where high blood pressure can lead to damage in the blood vessels of the eyes, increasing the risk of eye stroke. So, it is best to avoid factors that can cause hypertension and also be well informed with the treatment types based on other factors to ensure better blood pressure control and improve patient outcomes. I hope you find this video helpful and interesting. Thank you for watching.